Dear parents, today we will discuss a common topic: what to do when your baby gets fever. How to measure fever, different fever medicines, dosage and adjustments, preparations of medicines available. We shall discuss these topics. The first thing is to assess how much the baby has got fever. The best would be to use an ear thermometer, or you can use a digital thermometer, and the least preferable is using the non-touch techniques. An ear thermometer is usually more accurate. If you are using an axillary thermometer, which is a digital thermometer, you may have to add a 0.5 degrees centigrade to your measured value. Now, let's discuss the medications that we use for fever control. Medications, mainly we use paracetamol or acetaminophen and ibuprofen. One of the confusions that I find, not realizing that there are different preparations of medicine available in the market. Paracetamol is available as drops 100 mg per ml, or as syrup 120 mg per 5 ml, or 240 mg per 5 ml, or even 160 mg per 5 ml. Fevadol 160 mg per 5 ml, Panadol 240 mg per 5 ml, Adol baby and infant 120 mg per 5 ml, Adol drops 100 mg per ml, Adol syrup 120 mg per 5 ml. Available as tablets 125 mg, 250 mg, 500 mg, etc. and suppositories of 100, 125, 200 mg. And finally, we also have the IV preparation. Now, paracetamol is available in different brands as Adol, Panadol, Tylenol, Calpol, and so on. Coming to paracetamol dosage, a minimum of 10 mg per kg per dose is at least required, and a maximum dose of 15 mg per kg per dose can be used. In 24 hours, a maximum of 60 mg per kg only should be used. You should not exceed this value. Another important thing is you should know the weight of your child, because the dose is always calculated based on the weight. The interval between the doses can be a minimum gap of 4 hours should be maintained in emergency. Ideally, you should use it at 6 hours interval, but do not cross the maximum dose that you can use per day. You can skip the dose if there is no fever. Are drops and syrup the same? No. You can see that in 1 ml of drops there is 100 mg, whereas 1 ml of junior syrup, it only has 24 mg. 1 ml of the senior syrup will have 48 mg. So definitely they are not the same. Ibuprofen is available again as syrup, tablets, and suppositories, and the strength of course varies. Ibuprofen is usually available as Brufen, Nurofen, Ibugesic, and the suppository is diclofenac sodium. It's not same as ibuprofen, and it's available as Vovaran, Voltaren, and Jonac. Coming to the dose, a minimum dose of 4 mg per kg per dose can be used, and a maximum of up to 10 mg per kg per dose. But what we need to remember is the maximum per day should not exceed 40 mg per kg per day. Ideally, it should be used every 8 hours, but in case of an emergency, you can give it at a gap of 6 hours. Some of the parents may be thinking that the suppository is more effective than syrup. There is no such thing. Actually, the absorption from the anal canal is a little more erratic, meaning if you give it orally, we are more sure of the amount that goes into the bread rather than through the rectum. But the convenience is why we use suppositories. It's the same medicine you're giving either orally or per rectum. Now, if you look at ibuprofen suppository, it's a different one, which is the diclofenac sodium. In extreme situations, we do use diclofenac sodium, which is available as Voltaren or Vovaran, but preferably it's used as a last resort. Of the medications, the paracetamol is metabolized in the liver, ibuprofen is metabolized in the kidneys. So the safety margin is much more with paracetamol. Try to manage with paracetamol. When it is not getting controlled, add on ibuprofen. Now, you gave your medicine, say at 10 a.m. At 11 a.m. you find that the baby still has a high fever. Here, high fever would mean something more than 38.5 degree, or let's say something more than 101 degree Fahrenheit. Okay. So, if the fever is still high, more than 38.5, then add on your ibuprofen. Okay, can you give it both together? Supposing you had a 40 degree centigrade and you want to give both, yes, you can give it. There's no contraindication to giving both together. But if you can wait for 1 hour, lot of times you might just need one medicine. You can avoid an unnecessary usage of a second medicine. But what is your aim? Your aim is to manage the baby with minimum number of medicines. So, if there is fever, you give medicine. If there is no fever, you can stop the medicine at any time. Because our aim is only to give a symptomatic relief. The fever medicines will bring down the temperature. In many a situation, if the fever is mild, less than 38.5, you can avoid giving medicines even. Why do we get fever? Because most of the time the fevers are due to some viral illnesses, and sometimes it may be due to bacteria. These viruses in the body cannot multiply as efficiently at a higher temperature as at a body temperature. So the body is trying to protect your body by elevating the temperature. So if the baby is comfortable, active and playful, a small temperature, there is no need for giving medications. But then if you have a history that the child has some seizures or convulsions, there's a more chance for getting convulsions if you get fever. So for such children who have a family history of seizures, or who are known case of febrile seizures, or already on medications for convulsions, then even for milder fever, you can give medications. Otherwise, if your child is active and playful, a mild fever is as far as possible, you can avoid giving medications. You can give medicine at lower temperatures when you find the child is uncomfortable. Maybe the child has a headache, a body ache, child is irritable, then give the medicine and make them feel better. So obviously they will eat better, play better, and you will have some idea how the baby is going on. Now I will give you a chart of quick reference to know how much of medicine to be given for your child's weight based on what preparation you have. For instance, if it is drops, how much to give. If it is syrup, how much to give. And if it is the different strength, 120 milligram, how much, 240 milligram, how much to be given. So this is a quick reference chart given for drops and the syrups of various strength. This is to give you an idea about how to manage when you face a child with a fever at home. This is not a substitute for medical assessment and proper treatment. Hope this will be useful for you.